So currently for the follow-up, the EU guidelines recommend cystoscopy plus cytology every 3 months for intermediate and high-risk patients, and yearly imaging of the upper urinary tract, and also 4 biomarkers have been recommended by the guidelines. For me, one of the most important parameters and outcome of the biomarker is the high negative predictive value, so that you can be confident that if you're in front of a negative test, the patient can go home and you for sure know that the patient does not have bladder tumor recurrence or whatever. So choosing between the 4 biomarkers we have recommended by the EU guidelines, I would go definitely for those with a higher negative predictive value. The EU guidelines are recommending the use of biomarkers, especially in the low and intermediate risk population, in order to rule out a high-grade recurrence, which is not so frequent in these low-grade tumors. But for those high-grade or high-risk patients with high-grade tumors, the recurrence is usually as a high-grade tumor, and the current values of biomarkers, especially for bladder Ripple check, regarding the high-grade recurrences, they have a really high negative predictive value. So I feel quite confident, and we use this test for all stages of the disease, low, intermediate, and high-risk tumors, because we know that we won't miss almost any of the high-grade recurrences, and there's also an acceptable, a very good performance for low-grade tumors.